Ever pause to ponder the intricacies of our bodies, the silent heroes that work tirelessly to keep us healthy? One such hero is the red blood cell, the transporter of life-giving oxygen. But what happens when these little warriors are in short supply? That, dear friends, is called anemia. Anemia is a condition that arises when there's a decrease in the number of circulating red blood cells in our body. These cells carry hemoglobin, a protein that binds with oxygen and carries it to all parts of our body. When the concentration of hemoglobin drops, it's a clear signal of anemia. Anemia can creep into our lives in a number of ways. It could be due to an inadequate production of red blood cells or an excessive destruction of them. Sometimes it could be because of blood loss. The most common villain, however, is iron deficiency. Iron plays a crucial role in the production of hemoglobin, and a lack of it can lead to anemia. Now, not all anemias are born equal. They come in different types, and knowing the type is key to diagnosing and treating the condition. Anemia is usually divided into 3 categories based on the mean corpuscular volume, or the size of the red blood cells. First, there's microcytic anemia, where the red blood cells are smaller than usual. Iron deficiency anemia is a common example of this type. Then there's normocytic anemia, where the cells are of normal size, but they are fewer in number. This could be due to sudden blood loss or a chronic disease. Finally, we have macrocytic anemia, where the red blood cells are larger than usual. This could be due to a deficiency of vitamin B12 or folate. So how do we diagnose anemia? The first step is usually a complete blood count test. This test measures various factors, including the hemoglobin concentration, the hematocrit, or the percentage of blood volume that is red blood cells, and the red blood cell count itself. If anemia is confirmed, the next step is to check the mean corpuscular volume to determine the type of anemia. A reticulocyte count is also done. Reticulocytes are immature red blood cells, and their count gives an idea of how the bone marrow, the production house of red blood cells, is responding. Treatment of anemia, as you might guess, depends on its type and underlying cause. Iron supplements are common for iron deficiency anemia. In cases of severe or acute anemia, a transfusion of packed red blood cells might be required. To summarize, anemia is a decrease in the number of red blood cells, often due to iron deficiency. It comes in different types: microcytic, normocytic, and macrocytic, and is diagnosed using a complete blood count test and checking the mean corpuscular volume. The treatment depends on the type and cause of anemia. So the next time you feel an unexplained fatigue, remember it could be your silent heroes, your red blood cells asking for help.